Myself, Dr. Asha Khatri, passed MD in 1977 in Obstetrics and Gynecology from Pandit Jnm Medical College, Raipur, with gold medal and distinctions. My special interests are infertility, high-risk pregnancy and delivery, and endoscopy. Today I am going to share with you some important topics related to obstetrics which will help you in taking the proper decision. Premarital counseling. Premarital counseling is very important because so many conditions which you are not aware of can affect your obstetric outcome. First, you should know the HIV status of both the partners, because if one is HIV positive, the other can get the infection from the partner, and if the mother is HIV positive, then the baby can get infection from the mother during pregnancy and at the time of delivery. The Rh typing. Rh factor is decided by the type of protein on the red blood cells, and it is also called an antigen. Most of the people have protein or Rh factor on the red blood cells, and they are said to be Rh positive. And those they don't have the Rh factor or protein on the cells are said to be Rh negative. If Rh negative mother carries an Rh positive fetus during pregnancy, the small amount of leak of fetal blood cells takes place into the maternal circulation during pregnancy and at the time of delivery. Mother body produces antibodies to fight the Rh factor on the fetal red blood cells. These antibodies cross the placenta and reach the fetus, and they destroy the fetal red cells and produce a condition called hemolytic disease of the newborn. In mild cases, the baby will develop the jaundice. In moderate cases, it is the anemia of the newborn, and in the severe cases, the baby dies inside the uterus. There is a way to prevent the formation of her body from forming antibodies. Rh immunoglobulin containing Rh antibodies should be injected into the Rh negative mother during pregnancy and just after delivery. With ready-made antibodies now available, the mother's body seems no need to make her own antibodies. Thalassemia. Thalassemia is a genetic blood disorder affecting the red blood cells. It affects 7 to 8% of the Indian population. Some of the high-risk communities are Sindhis, Punjabis, Lohanas, Memons, and Hanushalis. Two main forms of thalassemia. One is thalassemia minor and the other is thalassemia major. Thalassemia minor, people with thalassemia minor generally healthy, though they may suffer from mild anemia. Thalassemia major. Child with thalassemia major is born when both the parents are carriers or thalassemia minor. Risk for such couple is every pregnancy, although it is 25%. Thalassemia major is a fatal blood disorder. A regular transfusion is essential to enable proper growth and development of the child throughout the life. Proper planning and use of 100% sure and safe method of contraception should be used to avoid the unwanted pregnancy before marriage. Now I am going to tell you about pre-pregnancy counseling. Antenatal care begins long before the patient becomes pregnant. All the patients should visit the gynecologist before pregnancy. Those patients who are at risk of medical and obstetric complications should visit to know when to become pregnant. Medical complications like diabetes, hypertension, thyroid, asthma, tuberculosis, epilepsy should try for pregnancy when they are under control. Genetic disorders. If patients have genetic disorder, then they can choose not to become pregnant and may decide for adoption. Folic acid should be started 3 months before becoming pregnant to prevent the development of neural tube defects like spina bifida and anencephaly. For more information, you can contact me through lybrate.com.